We are in the middle of a drug epidemic, and I'm not talking about opioids, about fentanyl. I'm talking about doctor-prescribed medications, and today specifically statin drugs, this class of cholesterol-lowering drugs. This is the most prescribed drug in the entire country and has been for many, many years, and until recently was in the top three highest grossing drugs for pharmaceutical sales. It recently got displaced by Ozempic, with the big Ozempic craze, God help us, and a certain class of cancer-treating drugs. And I don't view this as an improvement in the landscape of our healthcare system. In fact, I think it's symptomatic of its continued decline, but that's a whole other video. But why is a chiropractor concerned about statin drugs and cholesterol? Well, first of all, if you've been watching all of our old videos or any of them, you'll realize that, of course, chiropractic is not about treating back pain and the thing that most people, associate with chiropractic. It's really a whole person approach to healthcare. But that aside, even just as an initial point of contact situation, we have a new patient, they're experiencing, aches, pains, the stuff that people usually think of chiropractors for. They haven't been educated yet, just having been freshly introduced to this office as to what chiropractic's really about. Well, these are exactly the kinds of things that are major side effects of these statins, of these cholesterol-lowering drugs. So it's very important for me to know if they're on them, and that's why they're experiencing, the muscle ache, the muscle weakness, the body pain, just these normal side effects for statins. Because if it is, I can adjust that person for days, weeks, years on end, and those things are not going to go away. The clinical picture is not going to improve if they wake up every morning and they're popping drugs into their mouth that some person with a white jacket and a stethoscope told them they had to take every day or they're going to keel over dead. Okay, but actually, really, honestly, even on just a personal, intellectual level, I don't think they make a lot of sense. They've never made sense to me when you look even a little bit beneath the surface. Before I was a chiropractor, there was such a time. I have degrees in mathematics and physics. I worked as an engineer and a university lecturer, a mathematics lecturer, and so I have a little bit of knowledge of numbers and ability to analyze numbers and statistics. And just looking at these things, unless you're in like the absolute most high-risk categories, there's really very little absolute benefit, which is a statistical term, for taking these drugs. And what do I mean by high risk? I'm talking about people who have had heart attacks, they have coronary artery disease, they're obese, they drink and smoke, high stress, poor lifestyle. These are the high-risk people you literally would expect to have a heart attack tomorrow. That's what they're at high risk for. Everybody else is not high risk. Having slightly elevated or even moderately elevated lab levels doesn't mean that you're going to have a heart attack in your sleep tonight at all. So for those people who are not high risk, all the research, which is also, by the way, largely industry-funded research, believe it or not, even that research says that there's really little benefit for these people in taking the drugs. So what do they get for taking these drugs? Well, a bunch of other things. For one, all of these side effects I mentioned. But one of the biggest things to me, and the most ironic, is an up to 40% increased risk of developing diabetes for being on these drugs. And why is that such a big deal? Why is it ironic? Well, because diabetes is the number one risk factor for having heart disease and other metabolic diseases. It's the biggest risk factor for people. Now, that's like finding a child in your kitchen playing with a knife, and in order to protect them and get that knife out of their hands, you trade them for a handgun. You just give them something obviously more dangerous. That's what we're doing for these low-risk people by putting them on statins, where they have an almost non-existent risk of having any kind of heart disease, and instead we're upping their odds of developing over time diabetes, which is a very serious risk factor for getting heart disease. So already it's just insanity. Okay, but from a more chiropractic perspective, the biggest problem with this is, again, just like with the blood pressure video that we did a couple of months ago, it's about fitting everybody into this box, and the box is always changing. The guidelines are always changing. Yesterday, you might have been told that your bad cholesterol, which I hate that term. There's no such thing, but your LDL was high, and so we just need to monitor it. And today, you might be told, "Oh my gosh, this is an emergency. This is not good. These numbers, we got to get you on medicine. You got to take it every day for the rest of your lives." So it's always moving, and it's based on this faulty assumption of reducing people down to these individual numbers, these lab values, is somehow a measure, an indication of our health. It's not. It's taking this reductionist mindset and dressing it up as precision, and people are buying it, and it's ridiculous. No, God made our bodies as an organic whole, made them to function, made them to adapt to the situations that we place ourselves in or find ourselves in, to heal and to self-regulate. That's how our body works, and that's chiropractic's big job, is ensuring that there's no interference in that process globally. The rest of it, is you have to eat right, you have to, move right, you have to take care of your mental health, spiritual health, emotional health. All of those are important parts of this integral whole. What we don't have is a statin deficiency. Nobody on earth has a statin deficiency. That is the answer or the solution to what's going on with them. If their cholesterol is high at all, maybe it's just high against some relatively arbitrary laboratory standards. Maybe it is high, but the solution to that is just change your life. That means it's time to look and evaluate what's going on with your life. Are you seeing a chiropractor to make sure that everything is regulating properly? Are you eating properly, moving properly? Are you sitting in an office all day snacking, drive home, and you binge Netflix until it's time to go to bed, and you repeat, drinking and smoking or vaping the whole time? Okay, those are the questions you need to ask yourself. Now, I'm not suggesting if you are one of these high-risk people that you go see a chiropractor today and tomorrow, you flush your statins down the toilet. I mean, yes, do go see a chiropractor today, but there's a journey that needs to be taken. There are some serious steps and changes that need to be made to get your life back on track. But the first realization is that the answer to these problems is not in a prescription bottle. It's in God's intelligent design with which He made us. It's tapping into that. It's removing interference to that. And it's not about giving in to the fear factor, which is what is driving the medical world. They have us cornered because of fear, that if you don't take this pill because some numbers are high, you're going to die tomorrow. That's not how life works. That's why chiropractic is a life without fear. So hopefully this resonates with you. I encourage you, as always, to subscribe to this channel and share this video with people so that we can keep getting this message out there. I think there is an awakening going on where people are sick of being forced into that container of fear and told that they need to live their lives at the end of a prescription pad. It doesn't make any sense anymore to people. So please share this, like this, and we'll be getting more of this content out to you. We'll talk to you soon.